All right, welcome back. Now I have 60 seconds for everyone to come back into the main room. Welcome back. Okay, should be a few more seconds before everyone rejoins. Obviously, many groups we're in the middle of the work. Now everyone is coming back. Welcome back to all of you.
Yes, sir. Rather, you're right. The time was too short. We hardly managed to cover the first 3 points, and
That's already quite commendable. The time pressure is real, but it models the real world of work where we rarely have all the time we would like to have in order to solve a problem, develop a response to a challenge. So we are now, so let me just show you where we are in the schedule. So you've just had your first experience of the itch session. And now we are going to ask probably rapporteurs, but rapporteurs, note takers may wish to call on other members of their groups to present what you were able to do in this first 30-minute session. And we know that organizing as a group can take a significant amount of time. So if you were a rapporteur and are ready to present however much work you were able to do, please write your group number. So for example, if I'm group X, and I am ready to present, put group with, of course, the number of your group. Okay, group 5. All right. So we have our first presenter. So, and then group 9. So yeah, we'll try to go in. So we have already 2 groups. Ande Butap Elisha, the floor is yours, and then.
Okay, thank you very much. Can you see my screen?
Yes.
Okay, thank you. So this is group 5. The participants' names are there for our reference, and our challenge was a challenge from Iraq, where there is delay in sample transportation, especially for diseases that are not supported by vertical programs such as measles and rubella. And this causes delays in the overall VPD surveillance with delays in sample transportation to the Central Public Health Lab. Key components of these challenges include inadequately trained workforce for these programs that are not supported. So they do not collect or store samples correctly. Also, they delay in getting the samples to the lab. Sometimes there are inadequate sample collection kits. And the issue of financing, there's very limited resources to transport samples, lack of incentives for staff. And sometimes the sample collectors do not have funds to transport multiple samples. Once they've taken the primary sample they've come for, even if they are called to return and take other samples, that is not funded. So the goal of the challenge owner was to see how we can ensure timely transportation of samples for improved surveillance, and then to enhance the surveillance activities through improved coordination using mechanisms or systems such as task forces, technical working groups, partner and government coordination, harmonized work planning to strengthen overall surveillance system. What experiences were shared by others include the use of network of transporters in Cameroon, for example, where sample transportation was contracted out to private transporters, and then for integrated transportation, whatever sample is available, they need to transport it irrespective of the program. Then also capacity building. In Nigeria, we built capacity of DSNOs to provide surveillance for all activities. The DSNOs function at the lowest level in the community. So irrespective of whether a program is funded or not, the DSNO is trained to support those activities, including sample transportation. Then Liberia used a similar thing with Cameroon, using the Riders for Health. And Kenya improved coordination through better coordination. They created a WhatsApp group, and when samples are collected, it is posted on that group. If the samples are picked up, it is also reflected. So there's tracing of the samples up until when it gets to the lab. So for the concrete actions we want to take, We said improve communication between programs on how to integrate and maximize resources, just like this Kenya experience. Improve coordination between vertical programs, advocacy to government for financial support, consider batching of samples where possible so that they are taken to the lab, and then ensure regional labs to support the CPHL, because the distance to the CPHL might be very much. So if there are regional labs, they can support this. And then finally, to build capacity of healthcare workers on sample transportation and surveillance in general. Thank you.
Right, thank you very much. So, of course, here you worked on one case. Remember that by the 14th of July, so that's less than 3 days from now, or 3 days from now, you'll have to submit your entire project on your situation, your challenge. So as you work, as you do this group work, think about your own challenge and what can you learn from the process and the discussion and the dialogue and the feedback you're getting from your colleagues that will help you with your own plan. Let's now go to Anna Minta. So first of all, so this was group 5. Thank you, Ndebutop Elisha and colleagues. Anna, would love to hear from you. What are you able to glean from this presentation? Can you help us connect the dots in 2 ways? One, back to the global strategy, and second, to the to the action plan that each participant in the course is going to be doing in the next 72 hours.
Thank you, Group 5, for your presentation. That was great to hear. This highlights several important issues, primarily integration of functions. So the challenge was identified. Some specimens are not making it to the lab, even though other specimens are. And the challenge was very clearly clarified, I would say, because the challenge was the people who are doing the sample collection didn't get funding to come back for additional samples. So then the solutions that were raised by other countries I thought were very interesting, and they highlighted integration. So it was really using other services or different mechanisms, creative ways to make sure that all of the samples are getting where they need to go. So this presentation highlighted some really key issues for the action plan. For the action plan, you want to make sure that what you're proposing is possible, and it's something that you could do at your level of surveillance. And so the other people who responded what their countries have done, these are specific actionable items that they could take back to their district or national EPI surveillance program and say, we could hire drivers to do this. We could integrate with the other programs. We could start a WhatsApp group, tell them specific things that they can do, and that makes it more likely to be able to be implemented.
Thank you, Anna. Let's now go. So we have 2 presenters for Group 9. We have Fiti Melis Hagos and Deborah Akinola. So I don't know who wants, which of the 2 of you was going to share their screen. I will ask both of you to. Okay, yeah, done. And then, so is that? All right. Yes, that's Fitwi. The floor is yours. You will have to unmute though. Yes.
Yes. Okay. Thank you, Reda. Can my screen be seen?
Yes, indeed.
Perfect. Yes. Okay. Okay. So yes, I'm from Group 9. The list of participants, as you can see from the screenshot, I mean from the screen, 7 participants. So the challenge the group has decided to work on is on sustainable financing for vaccine-preventable diseases. This was raised by our group member Abdurizak from Somalia. So the overall problem in Somalia he mentioned was really this is the financing of vaccine-preventable diseases has really, challenged the program to not really function very well. So the group has also agreed to that this is really a real challenge in most of the countries where we are working now. So this is what we have decided. Yes, we have tried to go as much as we can, but not really in every part of the section. So from the workforce side, like we have raised, the strength is in terms of the sustainable financing of VPDPs. And the workforce is, of course, we have well capacitated personnel in terms of this surveillance. And of course, being the challenge, staff attrition is highly challenging, where it's due to the lack of the finance. The government is failing to, replace those trained personnel and who have been working on the program. In terms of the laboratory, yes, at national level, most of the countries have the capacity to test these vaccine-preventable diseases. But this is not really the case in subnationals, especially in big countries, where really the laboratory result is needed very timely in order to respond timely. So this is just directly related to the financing, to the challenge of financing. And in terms of information system, yes, I mean, many of the countries have in place the reporting system, the flow of the information regarding this surveillance. Of course, somehow financing for the reporting system, but still we have a challenge in, using a technology, a fast reporting system in all the countries. So, unless we invest on this in technology where we can get immediately within a very short period of time on reporting these vaccine preventable diseases, still we may not have enough time to respond timely for the outbreak. So we still have much to go regarding the information system. With regard to applied research, it is everywhere. It is in all the countries from where the groups have come. We are not really relating or integrating training institutions into this research or into vaccine preventable disease surveillance. So there is not research ongoing in countries specific to these diseases. So without a research that we cannot really we cannot really the gaps that we are having, and we cannot improve our surveillance system for vaccine preventable diseases. So yes, so the sustainable financing is a challenge in itself, of course. The strength is being we have a well-established specific disease surveillance as well as IDSR and the support from partners. And with regard to challenge, no government is currently funding sufficiently vaccine preventable disease surveillance. It's mainly partner supported. And each partner had their own goal or specific interest in this VPD surveillance, where it really cannot respond to the broad aspect of VPD surveillance. Of course, we have this opportunity and treat funders in there for for other specific diseases, like the way we were discussing earlier, like TB or meningitis. So these are also an opportunity for VPD surveillance. And the threat that our team member mentioned was like a lack of the government ownership on this vaccine preventable disease surveillance is really a threat to the program. So with specific goals that we agreed to work on is to have a sustainable vaccine preventable disease system, surveillance system in place, funded with sufficient financing for all the diseases that vaccine preventable diseases. So specific experiences, each partner have partners have sufficient funding within a given country, leveraging other programs, like I was mentioning, TB, meningitis, integrating to the already existing IDSR program, integration of surveillance program personnel in other surveillance programs, especially the way we have seen in COVID-19, where AFP surveillance or other surveillance personnel. We leverage that manpower to respond to a given outbreak, and so on. These are some of the experiences we discussed in our group. So the last point is on concrete actions we need to take in order to improve this challenge, this sustainable financing of the program, is like step by step transitioning the partner spending to the government. Is that one we thought should be the action. Having a regular meeting and experience sharing of the partners, so that we will not have a duplication of work. We will not have, at least one specific interest partners can cover the other diseases as well. So having this partner experience and regular meeting is very important. And the government to increase funding to the program and develop a tool that the government has sufficient financing for vaccine-preventable disease surveillance as far as it is a concern of WHO and other partners. So we discussed we need to have a kind of a tool that really tracks whether a government is really investing sufficiently to the program before we completely leave the surveillance funding to the government. We need to have a kind of tool that really shows how governments are committing themselves in order to fund the disease, and operationalize the existing EPI guidelines in countries. I think it's exactly what we have discussed, like the IA 2030, we have the guidelines in place. So how do we really operationalize this into the countries so that they have a real meaning of the guidelines in a certain country? And the policy to ensure the availability of funding, of course, countries need to have in their policy that addressing all VPD surveillance need to be funded. And bringing training institutions, universities, research companies into inviting them to do the research in vaccine-preventable diseases. So this is what we have discussed, and of course, a lot of discussion that I may like to track within this short period of time. I will incorporate and submit final report. Thank you so much. Over to you, Reda.
Thank you very much, Fitwi. Actually, over to Anna for her feedback. Just to the remainder of the groups, in principle, we only have 9 minutes left. We can take a 5 more minutes, so that means 15 minutes. You should really try to condense your presentation to 3 minutes, 4 minutes top. Anna, over to you. What did you hear? What's your feedback, questions, comments, and how do you connect the dots back to 1, the global strategy, and 2, the action plans that every participant in the course is now tasked with developing in a very short time?
Mm-hmm. Yeah, so thank you very much for your presentation. There were a number of very important challenges and action plans included there. One thing I will pick out to expand upon is that in the possible solutions for the sustainable financing, there was mention of developing a tool to demonstrate to the government that they have sufficient financing. So I thought this was very interesting because it means that for the issue, the general issue of sustainable financing, which could have so many reasons why, this group really thought about what is the problem in this particular context. And it sounds like here, it might be that the government is saying they don't have the money. In other contexts, the government may not know about surveillance. There may not have been advocacy, so they even know that it's an issue. Then there would be a different solution. But if in your country context, the issue is that the government knows about it and says they don't have money, then this is a very specific situation to address that issue. So that again ties with the surveillance strategy and also to the action plan that you're doing to really think deeply about what exactly is the issue in your context and provide specific examples. Thank you.
Thank you, Anna. Let's now go to Mersha Gorfu, is going to be the next presenter presenting for Group 7. Mersha, I've asked you to unmute and you, of course, are welcome to share your screen to show the notes you took as rapporteur. Mersha is not responding, so let's go to Group 8, Abdunasir Mohammed Elmi. All right, Abdunasir, are you ready to present? I'm asking you to unmute as well for Group 8. Abdunasir is not responding either.
Yes. Thank you very much. I'm ready.
Okay, please go ahead and share your screen. If you were the rapporteur, you should be the one with the Word document. Yes. Okay,
Yes.
Wonderful.
Yes.
The floor is yours.
Yes. My name is Abdunasir Elmi, and I'm the rapporteur of my group. My group consists of 8 members, and here are the names of the members. If I go to the challenge that the group has discussed, and as I'm the surveillance officer in Puntland state of Somalia, our problem of discussion was poor surveillance capacity in Puntland in Somalia, and the owner of this challenge is Abdunasir Mohammed Elmi. When it comes to the thematic areas of this surveillance training, we started with the workforce. Surveillance systems are very weak in terms of the staff number and technical capacity of staff. Also, we have there is also has high staff turnover, as there are no sufficient resources to finance the surveillance activities in the state. When it comes to laboratory, there is a recently established referral lab in Puntland state, but so far the lab does not cover all vaccine-preventable disease. Only specialist testing is done in the lab. Other diseases, for example, AFP surveillance testing is done in Nairobi, Somalia. The whole Somalia do not test or do not do AFP. Polio lab testing in Somalia. So we ship the samples to Nairobi to Cambridge lab for the laboratory processing. Also, we have problems with the transportation mechanisms of the samples from the far areas, especially the hard to reach areas or even in the inaccessible areas. Also, there is inadequate capacity for lab staff. When it comes to information systems, we don't have integrated information systems for vaccine-preventable diseases. Only AFP surveillance system use its own information system, but other diseases are incorporated in the E1 systems for other diseases. Also, there is a delay in information feedback. And about the applied research, we have a gap in this area. We have inadequate research in applied research. This is really a problem in Somalia. When it comes to sustainable financing, our problems include a lack of government financing in vaccine-preventable diseases. Surveillance systems are financed mainly by organizations, especially WHO. And the goal of our challenge is to improve a workforce in terms of training in surveillance. Core competencies include case detection, investigation of cases, and also investigation of vaccine-preventable disease outbreaks. Due to the limited time allocated for the discussion, we have been still working on this, but I go to the next point. The concrete action points the group discussed included development of the capacity for the staff, for surveillance staff, by training them on the key competencies of the surveillance core functions. Also, the actions include expanding laboratory capacity to cover all vaccine-preventable diseases. And another point is the integrate surveillance data management systems for all vaccine-preventable diseases. And also, and finally, improve the government involvement in surveillance financing to increase government ownership. That's our group.
Thank you, Abdunasir Mohammed Elmi. Let's go to Anna Minta now for some quick feedback.
Yes, so thank you very much, group, for your presentation. I understand the time was short, so it's okay that you didn't get through everything. The point that was raised is very applicable to the surveillance strategy about workforce capacity is extremely important. For the concrete action to increase the capacity, that is very good. And the next step for you all, if you have an issue like this for your action plan, again, is to think of how would you do that in your context with your action plan that you could take to your subnational or national EPI or surveillance program. What specifically could you tell them could be possible ways to do this? I also just wanted to acknowledge that you mentioned reaching out to your neighboring country for lab support, which was very interesting to me. And I think there could be some linkages that could be made there for capacity, workforce capacity as well. So that's something to consider. Thank you.
Thank you, Anna. Now let's go to the last group that will present today, and that's Group 4, Brenda Harrier. So Brenda, asking you to unmute. Yes, and Brenda's ready. I saw Group 7. It wasn't Mirsha Gorfu, but Dr. Alam. We'll see if there can be another opportunity to present. But Brenda, over to you.
I'm ready. I'm requesting that that Mohammed unshares, so I'm able to share my screen.
Yes. All right. Yes, go ahead.
Okay. So this is Group 4, and Group 4 in here are the members of Group 4. We're 8. The challenge that was identified by the group is sustainable financing for VPDs. This was raised by Dr. Muhammad from Nigeria, Dr. Akashi from Pakistan, Proskovia Kakoza, and Brenda from Uganda. And to go, okay. I'll get to the summaries of the challenge. So it's been raised that the main funding for surveillance activities is from partners and WHO. Then surveillance depends on polio funding. Yet funding is polio activities are winding out in Nigeria, which imposes a risk for continuity of polio surveillance activities. That's a case in Nigeria. And then for Pakistan, majorly also funding is by in surveillance activities is by polio, and this is also winding out, and it's completely a vertical program as it's been raised. This is no different from a case in Uganda. When we get to the specific goal, identified is to have sustainable funding for AFP and other VPD surveillance through government and partners. Experience is shared by other group members about the same challenge, where that there's lack of dedicated surveillance staff, which majorly roots from the financing directed to surveillance. There is no specific funding for surveillance activities. This was also raised, which is almost similar with the above point. Surveillance activities are majorly donor. Financing of surveillance activities is majorly donor-based. Surveillance work is left for partners, so there is no ownership of surveillance activities by the government partner, the government officials. And another member raised that sustainable financing as a challenge. It cuts across generally. The actions which were proposed by group members, one is multi-sector budgeting, where different sectors at national level and and national level, regional, come together and raise the gaps in the departments, and then have surveillance or IDSR also integrated. Use of strengths, weaknesses, opportunities, and threat tools to assess the existing IDSR system, and this can be used as a base to lobby for funding, integration and resource pooling at national level, advocacy for specialized disease surveillance program, and result-based financing. That's what we're able to put together as Group 4. Over to you, Reda.
Great, thank you very much indeed. Anna, final, and this will be the last presentation for today. We're going to give you 2 critical pieces of information, 2 critical steps that you need to complete as soon as you can in order to stay in the course. But first, the feedback from Anna.
Yes, thank you. Another great presentation. I appreciate all of the group work that you did. This challenge is in line with the surveillance strategy, and we definitely need to think of ways to improve the sustainable financing. I see several concrete actions here which seem like they can be implemented, and so it would be good as you're doing your action plan to think more about which of these may be appropriate for you or other examples that would work for your particular setting. Thank you.
Thank you, Anna. And so before we go any further, I believe for all the groups, even if your group did not present, a well-deserved round of applause before I tell you what is going to happen next in the